So these are the respiratory prep requirements. Number one, the brainstem regulates vitals. The midbrain pons and blank blank are the main vital centers. Number two, the blank nerve innervates with the diaphragm, which aids in the respiratory effort. Number three, the mucous membranes of the upper airway, like the nose, warm and blank air. It also traps debris. Number four, gas exchange is the intake or inhalation of blank into the bloodstream and elimination or exhalation of blank out of the bloodstream. Number five, the lungs are surrounded by a sac, the blank. This sac has two layers with fluid between them for the purpose of reducing blank. Number six, the blank is where gas exchange takes place. Number seven, CO2 blank pH levels, which makes it acidic. Number eight, HCO3 blank pH levels, which makes it basic or alkaline. Number nine, potential hydrogen is presented by blank. Number 10, the Allen's test assesses for blank of the hand before an ABG is performed. Number 11, ABG consists of the average of pH blank, CO2 blank, and HCO3 blank. Number 12, as the pH drops below its therapeutic value, the blood becomes more blank. Number 13, as the pH increases above its therapeutic value, the blood becomes more blank. Number 14, the gas that's behind the body's respiratory effort is blank, not oxygen. And now the application part. In tuberculosis, the patient should be placed in an blank pressure room to contain all spores and prevent the spread of the infection. Number two, PPD, or purified protein derivative, should be assessed for blank of greater than blank millimeters 48 to 72 hours after the intradermal injection to confirm exposure. Number three, a blank is performed next if the PPD is positive. Number four, only 3 consecutive sputum cultures, blank tests can confirm active tuberculosis infection. Number five, in COPD, blank becomes the gas that triggers a respiratory effort, not CO2. For this reason, high levels of O2 may cause oxygen blank and depress the respiratory effort. Number six, carpulmonal is when the blank ventricle fails due to long-term blank issues, like COPD. Number seven, as the patient's gas exchange is impaired, their CO2 levels blank and their oxygen levels blank. Number eight, blank develops secondary to mobilized DVT or long bone pelvic fractures. Assessment findings may include blank, blood spots on the chest, along with acute chest pain, severe dyspnea, and blank, coughing up blood. Number nine, patients who present with respiratory distress must be positioned with the head of the bed blank. Number 10, pursed lip breathing aids in the elimination of blank and maintains the airways open. Number 11, chest tube drainage systems must be observed for leakage, which would be manifested by blank bubbling in the water sealed chamber. Number 12, obstruction in the chest tube drainage system would be blank bubbles in the water sealed chamber. Number 13, pleurisy is inflammation of the blank. When fluid fills the sac, blank develops and may cause compression of the lungs. 14, a blank is performed to remove the fluid from the pleural space. The patient should sit upright with arms over the bedside table and should be instructed to blank take deep breaths. Thanks for this one too, guys.